Welcome back to MedSparkle. Today, we are breaking down a high-yield clinical concept that shows up in MRCP, FCPS, and also in our everyday clinical practice, metabolic syndrome. Now, what is it? Why does it matter? And how do you diagnose it under 30 seconds? And obviously, how to manage those patients. Let's dive in. So, metabolic syndrome is a cluster of metabolic abnormalities that significantly increases the risk of cardiovascular disease and also type 2 diabetes mellitus. It's not one disease, rather, it's a warning sign that your patient's metabolic engine is failing. So, according to the most widely used NCEP ATP III criteria, we diagnose metabolic syndrome when any 3 out of 5 of the following are present. As you can see on the image shown here, the first criteria is the abdominal obesity. For men, the cutoff is 102 centimeter or 40 inch. For women, the cutoff is 88 centimeters. So that's one of the important criteria. Then we have the triglycerides or TG, when it's above 150 milligram per deciliter. Then HDL, the good cholesterol, if it falls below 40 in case of men and below 50 in case of women, that's another criteria. The blood pressure level, when it rises above 130 over 85 millimeters mercury. And lastly, fasting blood glucose level, more than 100 milligram per deciliter, or in minimals, more than 5.6 millimole. So there are some other modification of this criteria. For example, IDF or International Diabetes Federation requires central obesity as mandatory, plus 2 more features, while WHO includes insulin resistance or diabetes as essential and adds microalbuminuria as a criterion. Now, why it matters? Why metabolic syndrome is so important? Because it doubles the risk of cardiovascular events and increases the risk of diabetes 5-fold. And it's very common, especially South Asians, middle-aged adults, and patients who have a sedentary lifestyle. Now, the management for metabolic syndrome is the lifestyle first, and then the medications. So we should focus on the diet, a healthy diet, weight loss, a regular physical activity. And for dyslipidemia, we can use statins to control the blood pressure. We should use the antihypertensive drugs. And if the resistance is high, then we can use metformin. To summarize, we should diagnose metabolic syndrome with any 3 of the 5 clinical features, which are the weight, the triglyceride levels, the HDL levels, the blood sugar levels, and the blood pressure levels. And then you should screen the high-risk patients, manage those patients aggressively to reduce the cardiovascular and diabetes risk. If you found this video helpful, subscribe to MedSparkle, hit the like button, and share with your MRCP and FCPS friends. Let's master medicine one high-yield topic at a time. Thank you so much.